Hello, this is Dylan Hoffman. As a part of the ATTR 725 Athletic Training Educator class through Indiana State DAT, uh, I'm going to be doing a summary of the readings from this week, week 10, regarding health disparities and health literacy. So to start this off, I want to discuss low health determinants. These are things such as in economic stability, education, health and health care, neighborhood and built environment, social and community context. The literature identifies these five: economic stability, things such as employment, food, housing instability, poverty. Education includes things like literacy level, whether they have a high school diploma or higher education. Health and health care includes things such as access to health care and their health literacy level, which we'll talk more about in a bit. Neighborhood and built environment, such as the crime rate, access to food care, or overall housing quality of the neighborhood. Social and community context, involving things such as, are they being discriminated against socially, are they incarcerated, or civic participation. Why this matters? It's associated with higher healthcare costs, more ER visits, and poor overall health, or even preventable death for patients who have low health determinants or living in these disparities. It's also associated with increased pain, poor mental health, limitations on activities of daily living and function, which all results in decreased health-related quality of life. People who are most often affected, the literature identified elderly, specifically those with less than a sixth grade reading level or lower, are twice as likely to have health disparities. Education level plays a huge. Those without a high school diploma have lower health literacy, putting them more at risk. Socioeconomic standings, so poor, those living in poverty, low income community members are most at risk. And then racial and ethical disparities, so whether they have high English speaking skills or not, puts them potentially at worse case of low health. And there may be cultural and racial stereotypes influencing the health or education as well. One of the articles mentioned this in African American collegiate male athletes and some of the racial or cultural stereotypes that were negatively affecting their education and access to education, and how that can obviously influence their health later on as well. So, ways to address this. We can address the social needs. So, integrating healthcare into society by being aware of the societal needs, adjusting to those needs, providing assistance and aligning our care and what we're doing to those, and then advocating to address those health disparities. Improving healthcare education and professional education. So we're creating providers who are aware of issues in their communities and are able to address it through their practice. And then improving patient education and communication, addressing low health literacy by creating information that's readable and understandable in appropriate levels in terms of terminology, and understanding the patient's background, so we're providing patient-centered care. So I want to talk more about health literacy. Generally, health literacy can be defined as a patient's ability to understand and use health information. How well can they actually understand the information that they're reading or being told, or how well are they able to understand health in general? So ways to improve health literacy. We can improve it through written materials. Oftentimes adults don't read past an 8th grade level, yet most of our material, whether that's brochures, etc., are being written at a high school or higher level. So determining our patient populations and adjusting our materials to meet those needs, whether that's simplifying our current documents, assessing where they are currently, and improving the readability of those, both through clean designs of whatever material we're creating and through writing that's simple and direct. Improving communication is another huge one too. So it's not just about reading level, it's about can the patient actually understand, and am I doing a good job of communicating and educating my patient. So educating and communicating about prevention and treatment information and actually giving that is big on improving health literacy as well. And putting a bigger emphasis on adherence and really showing the patient why it's important to adhere to the medical advice being given. There's an emphasis on social and family support, right? Use social and family support to help improve health literacy and implement patient beliefs into the plan of care so that we are actually treating a patient who's going to adhere to our treatment plans. So lastly, I just want to give some take-home points. These are things that I found really interesting or that my mind was kind of able to put together and what I thought I really received out of these readings. And the first is you can't take care of your patients if you don't know who your patients are, right? So if we don't know the health disparities or the health literacy levels of our patients, we can't provide the best care for them if we don't know who that patient is. So understanding our patients more is only going to help us improve. And we're going to be able to improve by identifying those health disparities first, because we can't help somebody if we don't identify what is putting them potentially at a level of lower health. And then we can eventually improve it through multiple levels, through a societal level. And through the society, we can improve things through professional development, professional education, and we can improve things through our own individual aspects as well, of the way we're communicating with patients, the way we're writing things for patients, instructions, etc., and our own personal developments to try and tackle some of these health disparities, particularly this lecture looking at ways we can tackle low health literacy. So thank you for riding through this with me. I hope that this was informative and you were able to get something out of this presentation. And I hope it was pleasant. Thank you, and have a great evening.